Hi, it's Crystal with birthingunconsciouschoice.com. Today I want to talk a little bit about placentophagy, or eating your placenta. Why would you want to do it, and why is it good for you? If you look at the animal kingdom, you'll notice that most mammals actually eat their placentas. With the exception of, there's only a few exceptions. Most mammals will actually go out of their way to consume their placentas. And there are a lot of theories on, why this is done, that have to do with, predatory world. Maybe, the mother just wants to clean up after a birth. And so, maybe that behavior originated from that kind of a need. But actually, even in species that it's not a risk, for instance, top of the food chain species like lions and cheetahs, and also monkeys, who they give birth in the trees. They will actually climb down to find their placenta and eat it after the birth. So the other theories are, that it's a concentrated source of nutrition, and that is probably a more likely reason as to why. And of course, we're mammals. When it comes down to it, we are part of the animal kingdom. For all our technology and progress, we are still mammals, and so it stands to reason that maybe consuming our placentas is actually a beneficial behavior that we have, that we had adapted over the years, but moved away from as we got more civilized. So you have to wonder, what are the benefits? And how on earth do you eat a placenta? Most women in America especially, probably, even if they've given birth multiple times, they haven't even looked at their placenta. It's quite sad, really. It's taken away, whisked away as something, dirty and gross and biohazard. Instead of, in other cultures, the placenta is actually honored as, something that nourished the baby. And it's a totally different cultural approach to something like the afterbirth. So the benefits of eating your placenta are actually pretty potent, pretty powerful stuff. There are three main categories of benefit, one of which is replenishing nutrients, especially iron. So if you're someone who is has had bleeding issues in the past, anemia, iron deficiency, anything like that, consuming your placenta is going to be excellent for your recovery and maternal health, because while we're pregnant, our body focuses on giving nutrients and nourishment to our baby. And so the reason they tell you to eat so well when you're pregnant is not so much for the baby, but for you. Because, for instance, if you're deficient in calcium, if you're deficient in iron already, and then during the pregnancy, your body is actually taking iron and calcium and all the other nutrients out of your body to give to the baby, to ensure that your baby is well nourished. So if you're not nourishing yourself adequately during pregnancy and directly after pregnancy, your own nourishment and health is going to suffer. So eating well during pregnancy is really more for you than the baby. But even if you've had, a hard time with these things, consuming your placenta is one way to give yourself a tremendous boost of iron. And even if you're eating it directly after the birth, if you're concerned about, for instance, postpartum hemorrhage, consuming your placenta is a very powerful tool to prevent hemorrhage. For instance, if you're having a home birth and you find yourself hemorrhaging, the quickest way to stop that kind of acute bleeding, which is, a life or death situation, is to actually cut a small piece of the placenta away if it's been delivered already, which usually it is. You would cut a small piece of placenta and just stick it on the inside of your mouth, like in between where your jawbone and your cheek are, with all those capillaries. And the hormones that are in the placenta are so potent and so strong, and they pass so quickly through the blood barrier with all the thin capillaries in your mouth, that the transfer of hormones from your placenta into your bloodstream is going to make your uterus clamp down and stop bleeding in less than 5 minutes. And most of the time, that's going to be quicker than the EMS team can even get to your house, let alone bring you to the hospital to get meds that would stop the bleeding. So, medicinally speaking, I think women need to be aware of what their placenta is capable of, just from a health and safety standpoint. It will stop bleeding in less than 5 minutes, even in the case of hemorrhage. I think for every woman having a home birth or considering a home birth, that's really important information to know. Even in the case of, say, an unexpected home birth, and that has happened. I've met many women that have unexpectedly delivered at home unassisted, and in the event of something like that, just the knowledge of what your placenta is capable of in terms of saving your own life, that's really powerful knowledge and medicine. Another major benefit to consuming your placenta has to do with the increase in your milk supply. And if you haven't, if this is your first baby, you won't necessarily have you won't have a benchmark at which to say, okay, my milk supply is increased this time. But with mothers who have encapsulated their placenta or consumed their placenta with their second or subsequent babies, they will notice a significant difference. And I know for myself, I have always had milk supply issues. I was always having trouble keeping enough milk to sustain my baby, especially in my third and fourth pregnancies, or my third and fourth children. Nursing them was kind of a struggle. I had to, work to keep up a milk supply. And my fourth one didn't wean throughout my pregnancy with my fifth. And so I was really concerned about my milk supply because I knew I was facing a tandem nursing situation where I would be nursing a newborn and a toddler at the same time. And I did encapsulate my placenta. And that's one of the methods you can use to consume it. I'll talk about that in a minute. And I noticed a very, very significant difference in my milk supply because I had abundant milk for two. For the entire time that I had tandem nursed, which was from the time my baby was 2 months until he was 6 months. And then I was nursing my toddler, and he finally weaned at 30 months. And I had plenty of milk for both of them, which was a completely different experience versus my other children, where I was having to, sometimes take herbals and really focus on my diet and be very concerned with how often I would nurse to keep up my supply constantly. And I didn't have to do any of that with after my fifth pregnancy. And I really attribute it to the placenta pills helping me with my milk supply. And it's not just anecdotal research. If you're worried about milk supply, or if you just haven't, if you're facing tandem nursing, or if you just, would like to ensure that you'll have plenty of milk, those are also very good reasons to consider consuming your placenta. The third most important reason is keeping postpartum depression at bay. And postpartum depression is something that I struggled with in various amounts after all 5 of my children's births. Or I should say 4 of my 5 children's births, because again, it was markedly different after my 5th baby. Not only was I not depressed, after the birth, I had abundant energy. I felt great. It was like I was on an emotional, spiritual high for several weeks at least, which was a complete night and day difference from the first, the early weeks of parenting my other children. And again, I really have to credit it to the placenta pills. They are, they replenish hormones, because of course when you're pregnant, your body is producing estrogen, and of course when you deliver the baby, your estrogen levels are high and your progesterone levels are low during pregnancy. And then when you deliver the baby, it kind of flip-flops, because your body needs to focus on milk supply. So your progesterone levels go high and your estrogen levels taper off. And this is kind of this hormonal flip-flop is kind of hard on your system emotionally. However, if you are consuming your placenta, especially if you have it encapsulated and you're able to wean yourself off of these hormones that came from the placenta previously, gradually, in the case of the placenta pills, you don't have this crash and burn style hormonal flip-flop going on in your body. And so you're much better equipped to not fall into a depressive state, or and be able to emotionally handle things so much better. So even if you're just, even if it's just the baby blues, or if you know that postpartum depression or postpartum psychosis is a very real, probable risk factor for you, that would be yet another reason to seriously consider consuming your placenta in one form or another. And so any one of these things, milk supply, depression, bleeding issues, any one of these 3 things would be a great reason to consume your placenta. I know in my case, all 3 of those things have been a problem for me in previous pregnancies. So I was gung-ho about encapsulating my placenta, and I was very blessed and lucky to have a friend locally that had just become a certified placenta encapsulation specialist. And yes, there are specialists. And so she took my placenta. I actually had a friend of mine come by right after I'd had the baby, and I had my placenta on ice, a little cooler pack type thing. And the placenta is actually not that big. It'll fit in a lunch box, like one of those insulated lunch boxes. Usually that would be adequate. And so my friend came and picked it up. She's a doula. She's comfortable with these things. And she brought it to our friend who is the placenta encapsulation specialist. And my dear friend Carrie, the placenta encapsulation lady, she prepared my placenta with a mixture of herbs, and she sliced it and put it in a food dehydrator. And then the dehydrated placenta was ground into a powder and mixed with other herbs. And then the powder was put into little V-caps, like the gelatin caps. And I actually have some placenta pills that are still left. And see, she just put them in a jar, a mason jar right here, and she's got her label on there. Every placenta makes a different amount of pills, or capsules. This one was actually 144 capsules. I guess that's kind of average. But as you can see, the encapsulated placenta, they're just gel caps. It doesn't, there's no flavor or smell. They're just like taking a vitamin. It's quite simple. And these pills are actually The protocol that you use with an encapsulated placenta is the first week, you would take 3 capsules twice a day, first week postpartum. The second week postpartum, you would take 2 capsules twice a day. Then the third week postpartum, you would take 1 capsule twice a day. And then anytime after that, if you're just having a bad day, if you're emotional, if you have like PMS symptoms going on, you can take a capsule, and it's actually kind of a mood lifter, a pick-me-up. Some people, if they have deep freezes, if they have access to a really good, deep freeze cooler, you can actually keep these all the way until you are hitting menopause, and you could take them to alleviate symptoms of menopause decades after your births, and they will help you with things like hot flashes and hormonal imbalances then. So it's really kind of neat what placenta pills are capable of. And like I said, I used a placenta encapsulation specialist, but you don't have to. There is plenty of information online that tells you how to encapsulate your placenta should you want to do it yourself. It's a matter of having a food dehydrator, some empty gelatin caps or V caps if you're vegetarian and want to avoid the gelatin. And then looking into if you want to include herbs. You don't have to. The placenta encapsulation specialists are certified by placentabenefits.info. You also don't even have to encapsulate it. Although I think for those of us who are squeamish, for those of us who aren't quite in that mental emotional state where they want to, say, handle their own placenta, encapsulation is so simple. You have your placenta encapsulation specialist will either work with your hospital or your midwife if you're delivering at home or at a birth center. If you're delivering at a hospital, or even if you're having a cesarean section, there is still a good possibility that your placenta encapsulation specialist will have some knowledge and experience with working with that hospital or those doctors, nurses, and it'll just be a matter of signing a form, and your placenta encapsulation specialist will sweep in, take your placenta, and in a couple of days, they'll probably come by your house and deliver you a jar of wonderful medicine. It's that simple. There's no complicated anything to worry about, which, of course, if you've just given birth, that's really, really nice. However, if you don't want to go that route, or you can't go that route for whatever reason, you can also use your placenta, consume it raw. You can actually cook it. There are recipes for placenta smoothies where you would put a chunk of it, say, in your blender and mix it with fruit. Red fruits would mask the color, obviously. And at this point, I'm sure some of you are getting kind of squeamish and grossed out. Believe me, it's an interesting phenomenon, because hearing about consuming your placenta raw in general doesn't really sound appealing, but for many, many women, they actually experience something completely different directly after they've given birth, and they see the placenta, and it's like something is shifted in their brain, and it looks delicious to them, and it smells delicious, and they want to eat it, and they don't have that reaction to any other person's placenta. It's quite different for, when you're considering placenta in general, but very many women find that they are attracted to and, almost salivating for a bite of their own placenta, which, crazy as it sounds, again, it makes sense. We're mammals. We have that limbic brain system that we, sink down to and operate from, and sometimes the urges that we have, especially in such a primal experience as childbirth, they don't always make sense, logically speaking. So if you find yourself attracted to the idea of consuming your placenta raw, it might be a good idea, because you won't know, until you're there. And of course, you have more of an opportunity to find out if this is the case if you're, home birthing. Whereas if you're at the hospital, unless you specify, they will, of course, whisk your placenta away. Probably to pathology if you're not careful. They will send it off to pathology and douse it in formaldehyde at the hospital, in which case it is definitely not fit for consumption anymore. And so if you are delivering at a hospital and you are committed to having your placenta encapsulated or consuming it in one way or another and you want to do it at home, make sure that you have a person, whether it's your partner or a doula or somebody, to keep eyes on that placenta at all times, because you don't want the nurses to whisk it away, because chances are if it's left your sight, they have done something to it that has rendered it not fit for consumption. And of course you don't want to take risks. So, which again, if you're giving birth in a hospital setting, that's another reason why I really recommend using an encapsulation specialist, because then they're the designated person. They can handle, the paperwork and the details and talking to the nurse or whatever it may be. The other ways that you can consume it, like I said, is just taking a small piece and, fresh, raw, and putting it inside of your cheek. And it's almost like a homeopathic remedy. But that's most useful in an acute situation, like postpartum hemorrhage, where, there's a life or death situation and you're worried about getting all the benefits from that piece of placenta very, very quickly into your bloodstream. Obviously, if you're going to use it just raw, it's along the same lines as, food preparation. You don't want to leave it out for a couple of hours, for even a couple of hours, because of, risk of spoilage and things like that. So some other things to think about, if you're, especially if you're having a home birth, is placenta consumption compatible with, say, a lotus birth? Delayed cord clamping? And the answer is yes. It's, with a lotus birth, if you want to have a lotus birth and do, placenta consumption, you would need to basically do what's called a partial lotus birth. And that entails keeping the placenta on ice and letting it stay attached to the baby for a couple of hours. And this is what we did with my last birth. We did a partial lotus birth, and so the cord was cut about 2.5 hours after the baby was born, and the grand majority of benefits from the cord blood and have already transferred to the baby by that point. However, like I said, those 3 reasons, milk supply, depression, bleeding issues, as much as I liked the idea of a lotus birth in terms of like nonviolent birth and gentleness to the infant, I couldn't pass up the 3 major benefits of placenta encapsulation for me, for my healing. And so that was kind of a compromise that I made as a partial lotus birth. That was the best that I could do for baby and the best that I could do for myself. So I was at peace with that. Definitely do your own research on placenta benefits. A good place to start is placentabenefits.info. Read some of the research that they're doing. It's really pretty fascinating stuff. In addition to those benefits, they're still discovering new, more complex reasons why consuming your placenta is actually a really good idea. For instance, they're completing research right now with mothers who are Rh negative. In other words, these mothers, when they are carrying a baby, they always have to check the baby to see if the baby is Rh positive, because the mother's body, if the mother is Rh negative and the baby is Rh positive, the mother's body will actually attack the baby as an antigen, and it's a very dangerous situation that can lead to loss of your baby. So, these mothers have to make sure that they get the RhoGAM shot, which is which will help their body to accept the infant. However, they're doing research with consumption of placentas where in an Rh negative mother who consumes the placenta from her Rh positive baby, they are finding that in subsequent pregnancies, the mother, even though she's still Rh negative, her body is less likely to attack the child, the subsequent child that she's carrying, even if they're Rh positive. So something to do with consuming the placenta of that Rh positive child actually changes the mother's physiology into her next pregnancy. And this is really fascinating research because this could potentially, give another avenue besides just giving the RhoGAM shot to save these babies' lives in mothers that are Rh negative. So it's really fascinating research that they're doing. And, the implications for it in terms of health and wellness, it's just really fascinating. And so if you have, if you're worried about recovering after your baby, especially if you're worried about not having enough energy, if you're worried about any kind of bleeding issues, if you're worried about your milk supply, if you're concerned that depression may be an issue for you, please look into placenta encapsulation. They really are kind of magic pills, in my opinion. Check out placentabenefits.info and have a beautiful, peaceful birth.